Guess we can start getting the show on the road a little bit. My name is, if those who don't know who I am, my name is Yaakov Lazar, co-founder and co-director of Kol HaNeshamot, co-founder with my wife. Just to give everybody, those who don't know what Kol HaNeshamot is about. Kol HaNeshamot started about 4 years ago very quietly, working with parents, going through a struggle of a child who unfortunately has decided to go in a different direction. Many of these directions become, children are dysfunctional. The fighting, eventually it'll work. There could be fighting, there could be many different things going on, but the problem is that we don't get a handle on what the child is going through. And we as parents find that we're stuck and we don't know what to do. Many times we can catch it early. We take the child for an ivchun, they're diagnosed with different labels, whether it's ADHD, whether it's bipolar. There could be millions of different diagnoses. But the problem is we just want to make sure that we get the right diagnosis. Because many a time, children grow up through difficulties, there's trauma involved, and when we as parents don't know what's going on, we can't work with the child to work in the right direction. When we're told one thing, but it's actually something else, we end up doing the right method, but for the wrong child. And that kind of causes a disintegration in the relationship between the parent and the child, because the child does not feel that anybody's feeling what they're feeling. Nobody's seeing them, nobody's hearing them, nobody's understanding them. The parents aren't understanding them. The parents, in the meantime, are doing everything right. They're just doing it for the wrong child. And things just continue to get worse. So eventually we have children who go and stop keeping Shabbos, stop eating kosher, and the fighting continues throughout the home. Kol HaNeshamot began in order to help parents find the right way and speak to the children in the right manner. Not only that, but it's also to be there for you, and when the pain of the parent watching their child disintegrate right before their eyes, when you feel that you have no one to turn to, no one to talk to, no one to be with, no one can understand you, well, you have a home in Kol HaNeshamot, because we do understand you. We have been through it. Everybody that works and has been a part of Kol HaNeshamot has unfortunately gone through the process of watching their child or children completely disintegrate before their eyes and not knowing what to do. Until we found the answers, and Baruch Hashem have been able to create a relationship with their own children. And the most important part of it is that the child now feels they have a mother and a father, and they were able to begin to work, become functionally better, and go about the right ways. We decided, based on what is going on in the community around us, to put a little lecture series together that we feel is very important. One of them is the first part, which you'll hear tonight from Chava Kadosh, is how to attune into your children to make sure we're getting to the right area, to the right diagnosis, to the right place of what the child is going through. Because it may be, and it may be something else. And we just want to make sure that you have the right answers and the right questions and what to look for so you can approach the right people to get the right responses. And not just come up with something and say, based on what they've been going through for the last 20 minutes or the last 2 years, that's the answer. Well, what about the first 8 years or 10 years or 12 years of their life? The child was a totally different child. So that has to play a part in that diagnosis as well. If we misdiagnose and if we mistreat, if we misunderstand our child, it can lead to many different factors. In today's world, where there's so much at hand, where they have so much instant gratification, the social media where they can get grabbed hold of, where they can find themselves lost in places that we would never have imagined when we were growing up, because they didn't exist back then. And many things that did exist that you had to really look for, that today they can find at the tip of their finger. They can find at a click of a button really fast. And once they get into that, they get lost. And it can cause addictions that we don't understand how to get them out of. And again, if we're still in the fighting mode, and if we're still working with a child who doesn't know what they're doing or what's going on, unfortunately today, suicide is actually a topic of discussion for the children themselves. They discuss it amongst themselves about how to commit suicide and how to go about it and what to do. It's a process. It's a long process, but it is a process, and we're watching the disintegration of these children. And our job as parents, as hard as it is to get them out of that place. And at the same time, with your pain of watching it, because we know you love your children, and you will do anything in the world that you can imagine to do for your child. You just need somebody there to talk to and somebody to help you through it. And if you can help yourself, you can help a neighbor, you can help a friend who are going through it, who feel that they don't know what is going on. And if you see a child who may be going through the process of what you're going to learn a little bit tonight, you can turn to your friend and to your neighbor and say, hey, I see what's going on with your child, and not be silent, and say, there is those that can help you. The more we tune into our own children, the more we tune into our own neighborhood and to our neighbors' children, to our community, we can help get these children off the street and out of the dangers of society that has put them through. So without further ado, I'd like to introduce Chava Kadosh, a child specialist, and we've worked really hard to put the right people into play that really to help you understand what is going on. Thank you very much.
Okay, good evening, everybody. I'm Chava. It's good to be here tonight, and I am really excited to be speaking about this topic, fostering resilience, connection, and attunement in our children. Just before getting started, a tremendous akar satov to Kol HaNeshamot and the Lazars for facilitating this workshop and for really being a resource in the community. Mr. Lazar beautifully introduced a lot of what I'm going to be addressing tonight. This title doesn't even begin to encapsulate the unprecedented crisis that we are experiencing as a community, as well as the struggle that parents and children are going through to try to understand what's going on. And so my goal tonight is twofold. I want to give you information for parents who are saying, what do I need to put in place? What are some of the key ingredients to provide safety and security within my home, within my child? And for parents who are stuck, and this is happening more and more, that I'm hearing from parents, that I'm hearing from adults who have gone through this themselves, what is it when we feel like we've tried everything, we've done everything, we've gone to one clinician, we've gone to get hadracha from this area, from that area, and we have no idea where and how to proceed. Now, the time is limited. I know I want to thank everybody for their promptness. Obviously, anything that I'm going to be discussing tonight, I could do workshop upon workshop upon workshop. And if I can get on my soapbox, we would have lecture after a lecture. But the time is short. So this is really going to be a smorgasbord in terms of being able to introduce you to some ideas. And of course, if anybody is interested in further reading or resources, it's my pleasure to try to connect you. I really feel that the more educated we are as a community, as parents, the more that we are able to go home and to really put our tools and our practice in place. Now, having said that, I don't expect anybody to walk out here tonight either, having ready to solve the problem or to be a diagnostician and say, yes, my child definitely has ADHD, or yes, this is definitely complex trauma. Halavai, right? That would be a good start. But what I'm really hoping is that you'll walk out of here today, and you can switch the slide, with more of a sense of how to be a compassionate explorer, how to be looking for certain key behaviors within your child. What are some red flags to be looking out for? If there are certain things that you're noticing, what might be some things to consider in terms of next steps? And of course, how do we help our child? And I think Kol HaNeshamot says it best, feel safe, secure, seen, and soothed. So we're going to talk a lot about that because that really describes that attunement piece. So here's what I'm hoping to do today. We'll go to the agenda. I want to explain to you a little bit about child development, specifically how the brain develops so we can have an understanding of what's typical for children. I also want to address factors that might relate to kids who aren't neurotypical, to kids who aren't necessarily developing in the way that one might expect, or as we call it, developmentally emergent. I want to talk about complex trauma and, in general, stressors that can mimic neurodevelopmental challenges. I cannot tell you how often I have a child or an adult come into my office and say, yes, I have ADHD, or I was diagnosed with an autism spectrum disorder. And as the history unfolds, as the complexity unfolds, we recognize that it's not so simple. And we're going to see in action why something that might look like a neurodevelopmental challenge might in fact be trauma, and vice versa. Then, of course, I want to talk about what are the key ingredients to put into our children, into our homes, so that we can facilitate healthier development. And lastly, we're going to try to just even leave here with some practical tools and intervention practices. So if there's one goal that I have for you today, walk out being a compassionate explorer. Think about a 2% shift, either in your mindset or what you could bring into your home to facilitate some sort of change, or to further your journey if you're already doing these things. Okay, so now that we've talked a little bit about what we're going to do today, I just want to also leave you, before jumping in, with this idea. Neurons that fire together, wire together. What essentially that means is we have billions of neurons in our brain. And what gets cut or what gets pruned and what stays is very much dependent on a child's experience in their home environment, within the safety of their caretaker. And I always start a presentation with this idea, or even describing this to parents, because a lot of times we feel very hopeless, especially when a child has a neurobiological predisposition towards a particular challenge. And one message that I want you to think about as we're going through this presentation is, even if a child has a predisposition, right? There are neurobiological factors that are playing into their development. Even if a child is dealing with any sort of adversity, the thing that could be the make it or break it for the child is a positive, adaptive response by somebody significant in their life. Ideally, it's their parent. But for any educator in this room, or anybody who works with children or with individuals in a different context, it could be them as well. It doesn't always have to be within the home. And that's a really hopeful message, because Hashem made us that we are brain architects, that regardless of the challenges that we're facing as a community, or even within our homes, we have a tremendous amount of hope and belief that healing and growth could happen at any point, regardless of how stuck an individual is. Okay? I want to start with a little bit of an exercise. For the sake of time, we're not going to get too much into it. But now that you're here, you're listening, I have you, trusting me 100%. I'm going to have everybody take a moment here to think of a situation that might have happened recently, where you had a strong emotional response. It could be, you can switch to the next slide, that you were stuck because of something somebody said, or something somebody did, or perhaps something that triggered you within the family, outside the home. And I want you to just think for a minute, when you think about this memory, okay? Anybody have an experience of feeling it within their body? Okay. Consider for yourself for a minute what that sensation might be, and on a scale of 1 to 10, how strong it is. And just for a minute, or a couple of seconds for the sake of time, notice it, and I want you to think, how did you manage the moment when this trigger or this situation happened? Okay. Now, for some of you, this might still resonate to this day, where you're saying, I'm still managing the moment. Now, I'm also curious to ask you, do you think that this experience impacted your ability to function, or to manage, or to fulfill your responsibilities, or even to be present? Because I know that when I've had very overwhelming emotions, you could ask me if the house is on fire and my brain might be out the window. I ask you if the feeling passed, because for many of our children and for many adults as well, especially for people who have experienced trauma, that feeling doesn't leave. And what happens is that if your body holds on to a particular experience, the body keeps score. The body holds on to it. The brain, while it might not be cognizant of what it's going through, is holding on to it as well. And so that means if you have somebody day in and day out whose life underwent a tremendous change, maybe their family made aliyah and it threw them for a loop, or maybe they're struggling in school to keep up with their peers and they can't figure out, no matter how hard they try, why there is no academic success. Or every morning they wake up and they think, yet again, I have to try and get someone to talk to me when I feel completely isolated and like I can't make a friend no matter what I do. I go home and I'm just trying to manage and my parents think that I'm not motivated or I don't care. And I can't express or communicate what I'm going through. Now imagine that sitting within the body of a person day in and day out. Do you think that they could be present? Do you think that they could fulfill their responsibilities? Do you think that they can act in ways that one would typically expect? So in order to fully flesh this out, I hope there's no neuroscientists in the room, and if there are, this is going to be a very superficial understanding of the brain, but nonetheless, I am going to hold up my hand here, and I'm going to show you a brain model. So over here, we have our brainstem that typically develops between birth and, in utero until about 8 months. That's the part of the brain that I don't really want to focus on today. It's the autonomic functioning, it's breathing, blinking, all the things that we never have to be concerned about. We're going to skip the cerebellum and motor development because also not applicable for what I want to talk about. But the area that I want to focus on is our limbic region and our cortical region. Now, through the ages of 1 to 4 or 5, the emotional center of the brain, right over here, right, if we're going to look at my hand model, is the area that's most dominant. That's why when you look at your toddler and you say, what are you thinking, as they're pulling down the shelf and coloring on the walls, they're not. Because it's the emotional part of the brain that's going full force, and that includes impulse control as well. Now, from age 5 and up, what we'd like to see happen is that the cortical region of the brain, the thinking part of the brain, basically comes and controls that feeling part of the brain. So what happens is, I'm really mad, but my thinking part of the brain comes in and says, no, 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 I'm not going to throw something, okay? Now, what happens is that as people continue to develop, our limbic region, our cortical region are just being strengthened time and again, right? There's a staircase connecting the two. Except, here's what happens. If I am hungry, angry, lonely, tired, if I am overwhelmed by emotion, if I am experiencing stress day in and day out, what happens is, boom, that staircase that's connecting my feelings part of the brain to the emotional part of the brain starts to disintegrate. Another interesting fact to just know, because a lot of times, people see this diagram and they say, well, teenagers, young adults, like that thinking part of the brain should already be strengthened so that we're making good decisions. Except that a teen has a brain that is closer to that of a toddler than they do to that of an emerging adult. Okay? It's really important to recognize because the only people who seem to have figured this out, by the way, are insurance companies in the States. Driver's insurance, when you hit 25, your rates drop drastically. And that's because they say, yay, we have an adult in our midst. Until that point, we really expect teenagers in many respects to operate like toddlers. Well, the brain, the way that the brain develops, well, we're going to talk about, again, what's normal, but in terms of the context of brain development, we really hit maturation at the age of 25, and that's when our brain is also less plastic, which means at the age of 25, our brain is less moldable, which is why it is harder to make changes later in life. Okay, so going back to that idea, right? If we're carrying so much in our system, what's going to happen to our brain and our ability to plan ahead and make good decisions and meet goals and display self-control and all of the things that relate to the beautiful concept of executive functioning? So the best way that I can explain executive functioning to you is, imagine you have a secretary sitting in the seat of the brain. Now, this secretary is responsible to get you the coffee and, take a deep breath if you're having these deadlines, and don't worry, I have that shirt lined up for you. And right, is constantly managing all these different pieces. And what they're using in the context of being able to manage all the different parts of your life is emotional control, impulse control, organization, task initiation, being able to plan and prioritize, working memory, flexible thinking, being able to shift and work when things aren't going well. But again, if you have stressors in your life that are ongoing, or if you've experienced a major stressor in your life, this area is going to be impacted. Now, if I polled the room and I said, how many of you know a child or an individual within the context of your own lives that is struggling with executive functioning, how many hands would go up? Everybody. Great. So, does everybody have ADHD? Does everybody have some sort of executive functioning disorder? Well, the idea, and you can switch to the next slide, is that there are individuals who Kadosh Baruch Hu made that have a predisposition to neurodevelopmental disorders. Now, when I'm talking about neurodevelopmental disorders, I'm talking about conditions that begin in childhood and that have a major impact on social, cognitive functioning, and social interaction, along with communication skills, behavior, etc. Specifically, we're talking here about ADHD, autism spectrum disorders, intellectual developmental disorders, which is what we used to call mental retardation, learning disorders, etc., etc. Now, oftentimes, these things get picked up, but oftentimes they don't, or they get misdiagnosed. And the thing about neurodevelopmental and related disabilities is that it's very much related to how the brain and the nervous system unfold over the course of development. Now, we know that it affects 15 to 20% of the child population. These numbers, by the way, change every year depending on where you are. Sometimes the numbers go up, they rarely go down. Research suggests that individuals with neurodevelopmental disabilities are at greater risk for experiencing stress and trauma. And that's not surprising, right? Because if you are already at a disadvantage, it's going to be harder to keep up with people or to read social cues or to understand certain academic principles or to communicate this struggle. We know that, let's say with ADHD, 2 out of every 3 kids have another co-occurring condition, which again makes sense in the context of really feeling at a loss or not having control over your environment. One thing that I wanted to put here, one study indicated that up to 20% of young children with an ADHD diagnosis might actually not have that condition. And that's really important, and I want to highlight that today, because we're going to talk in a couple of minutes about what happens when the brain does experience stress. And like we said, that could very much mimic poor executive functioning. The last thing is, and this speaks to what Mr. Lazar said in respect to individuals with suicidality, individuals with autism spectrum disorder were 9 times more likely to try, but were 9 times more likely to die by suicide than individuals without ASD. Right? That's an unbelievably compelling statistic and really speaks to the importance of proper diagnosis and proper treatment and proper intervention. You can go to the next slide. There is going to be an upcoming workshop on suicidality, and the presenter will go more in depth, but I just wanted to make sure to address that today in the context of an individual who might not be neurotypical. Okay. So this is where I put on my other hat. I'm a psychologist that works with neurodevelopment, and then I'm a licensed clinical social worker, and that really my specialty is complex trauma. So when we talk about trauma, I want you to consider this idea, okay? Oftentimes we think about a one-time incident, and this is what we're going to call acute trauma. It's sort of like a shock trauma. It happens in a particular place and a time, and it's usually short-lived or it's sudden. God forbid, an attack, something that really is injurious and impacts life and threatens our sense of safety. There's also historical trauma, which is another passion of mine, and I think it's really apropos when we're going to talk about crises that the community is facing, to recognize that intergenerational trauma is a big piece, right? working down in terms of the Holocaust and how that's impacted our community, and it's something that needs to be taken quite seriously. But what I really want to focus on in this presentation is chronic trauma or complex trauma. And this is trauma that's often misunderstood because it's very nuanced. And I think I have it on a slide coming up, but just in case I don't, because it's such an important thing. Trauma, and I'll give it a few different definitions, but trauma is not what happened to you, but how you've experienced what happened to you. There is this belief that trauma is overblown, that it's used. I want to come forward and put up my hand and say, as a clinician, I think it is significantly underestimated. I think we don't recognize how profound trauma is, not only within our community, but as an experience of humanity. And this is something really important to consider because, again, it's not what happened to you. It's how your body holds what happened to you, which means I might experience something and I might feel it like a 1. I might not feel it, but you might feel it like a 10 because of your life experience or because of your neurobiological wiring that is completely beyond your control. So this is really important to recognize because oftentimes parents will say, but there was no trauma. And I want us to think about, well, what is trauma? What does that mean to experience a stressor in one's life? We can move to the next slide. So as I said, complex developmental trauma begins early in life. It's often within the caregiving relationship between parent and child, and it leads to immediate and long-term difficulties in many areas. It doesn't have to be within the context of a caretaker. What really differentiates PTSD, right, trauma as we frequently talk about it, versus complex trauma, a threat, the avoidance of that threat, and re-experiencing. Intrusive thoughts, flashbacks, nightmares, right? That's trauma as we typically define it. Complex trauma, it impacts interpersonal relationships, it impacts our mood, and it impacts our sense of self, how we feel about ourselves. Okay, so I want to talk about this just to sort of demonstrate the profoundness of complex trauma. Anybody here familiar with the ACE study? Okay, fantastic. So between 94 and 97, Kaiser Permanente, which is the largest health umbrella in the United States, in conjunction with the CDC, the Center for Disease and Control in Atlanta, started to do this study where they actually weren't looking at mental health. It had nothing to do with trauma. They were looking to try to understand weight loss. And what was happening was they had, I think it was 17,000 participants in this study. And when some of these participants were almost reaching their goal, all of a sudden they were self-sabotaging, they were binge eating, they were doing all sorts of things that were causing them to gain weight, some of them rapidly. And the study said, whoa, what's going on here? We really got to figure out what's happening. So they went back and they did this survey where they tried to look at different areas within the lives of these individuals, and they were looking at abuse, neglect, and household dysfunction. And there was an incredible corollary that the more levels of experiences you had, negative childhood experiences, the higher the risk was in terms of negative health outcomes. Okay, so they were not just looking at mental health, but they were seeing how this unfolded in terms of cancer, in terms of obesity, in terms of kidney failure. And what I think is the most compelling part of this study, individuals who had really high scores and really a lot of checks. And again, checks, yes, there was abuse, there was domestic violence, but they were asking things about divorce and about mental health and about drug use within the home and about separation. Those who had incredibly high scores on the ACEs, does anybody want to take a guess how many years it shaved off a person's life? Throw out a number. Anybody else? 20 years off a person's life.
How did they know?
Because they followed up. They followed them. It was a long-term study.
What do you mean? They saw that this person died earlier than what should have lived?
What was the national average, for example? This was done in the United States. Okay, so this is really important because, again, we know that complex trauma doesn't just impact ourselves in the short term, but there's a whole slew of other things that are likely to impact an individual. And some of these, right, if you look at over here, difficulties with learning, memory, and emotion regulation, but that's ADHD, right? Or difficulty trusting others and forming healthy relationships, well, that might be X, Y, or Z, which is why it's really important to have a keen understanding or to be asking the questions to try to get a deeper understanding of what might be going on with a person. Because a lot of the things here, if you're just looking at it, you might say, hey, but can't that be an intellectual disability, right? Fewer neural connections, or can't this be a mood disorder, or can't this be, a personality disorder? So it's just very important to really try to delve in and get to the bottom of what are some of the factors that might be lending itself to certain behaviors. So just to understand how this happens, our response to stress. I meant to bring with me one of those, I forget what they're called, but they expand and then close. Anybody know what they're called? Accordion. Not accordion, like those round things, no? It's like a fancy name, but nonetheless, imagine that I'm holding it right now. We have what's called a window of tolerance. So I'm going to open up my balloon. We'll call it a balloon, for example. I'm going to have my balloon here. And our window of tolerance is basically our ability to contain and hold our stress and what's going on in our lives at any given moment. Now, there are times we are going to experience tremendous stress, and we might experience what's called hyperarousal. Now, hyperarousal is literally, I'm going to assume the balloon is inflating. It's when our heart starts racing. It's when our body might go into fight mode. It's literally when we might appear aggressive or irritable, or we might present with what seems like outlandish emotion, right? You ever see somebody and you think the size of their reaction doesn't really match the size of the problem? That could be hyperarousal. Conversely, anybody ever experience a teen who says, I just want to stay home today. I just want to lie in bed. I don't want to come out. I want to self-isolate. I don't want to eat. I'm feeling down. That's hypoarousal. That's when my balloon contracts. And these can be signs of what's called a sensitized stress response. So a sensitized stress response is a really fancy way of saying, my body has been primed and has been activated. And even though there's no current threat, my body feels like there's a threat at any given minute. Another way I could describe this is, anybody ever light a Havdalah candle and the fire alarm goes off? Just me? Okay. Very sensitive fire alarm. There's no emergency. There's no actual fire, right? But the alarm says, no, but I'm primed to pick up on a disaster. I'm primed to pick up on an emergency. That is the system of somebody with a sensitized stress response. Whatever you're going to say, whatever you're going to do, it's like the makah b'patish. It just inflames them or causes them to shut down. And that's because their system is used to alarm bells going off, okay? So to best illustrate this, just talking about this for a minute, fight, flight, freeze, right? Fight, verbal attacks, aggression, flight, running away, refusing to talk, substance use, freeze, appearing non-responsive, withdrawing, numbed out, disconnected. I don't know, right? Anybody ever experienced that from a teen? And of course, we have a physiological response. Whether or not we recognize it, our bodies are responding to that emotional reaction. Okay, so again, I'm going to go back to this idea because I am so incredibly passionate about it. In case you can't tell, trauma is not what happened, but how the body reacts to what happened. Okay, some childhood stressors. So we talked about complex trauma in the context of somebody being in a home where there is significant abuse, dysfunction, et cetera. But I want to be very frank with you. Most of the time, when I am working with an adult who experienced trauma or working with a child, parents will tell me, whoa, that's not our home. And usually, they are 100% correct in telling the truth. But there are other factors that can lend itself to complex trauma in the home or in school or with peers, okay? And some of those things are as follows. a parent denying your reality. And I also want to say that, I want to be very careful because this is not chas v'chalila to point fingers or, this is to recognize that there are nuances with how we experience things. And a parent denying reality doesn't mean saying, no, you're not. It could be a child who really has a neurodevelopmental disability or a mental health challenge, and it goes unrecognized. Not being seen or heard by peers, educators, etc. There are many children who have wonderful home environments. And by the way, that's the make it or break it ultimately. But when they go to school and they are constantly being put down or they're told, we don't understand what's happening or why you're not motivated, or their peers are ridiculing them or bullying them, this plays into their ability to feel good about themselves. And for some children, that is complex trauma. Having a parent who vicariously lives through their child, being told directly or indirectly that one can't or shouldn't experience certain emotions. And over here, I want to differentiate emotions from behavior because it's important to set limits with children and to recognize that certain behaviors are beyond, right, the scope. But the emotional experience, what a child should and can feel, is separate from that. But when a child is consistently told, you can't feel this way, that is something that could lend itself to an environmental stressor. Having a parent who overcompensates for what they felt was missing in childhood. Having a parent who is focused on appearance, and everybody's focused on appearance to some degree, but we're talking here about ways in which it really impacts a child's sense of self. Having a parent who cannot regulate their own emotion, we're going to talk about this shortly. Underlying confusion and frustration at not understanding self and behavior. I don't understand. I was told I have this. I don't understand. I'm taking medication. Why am I not okay? This in and of itself can be quite overwhelming for a kid. And not feeling felt. We used the word attuned to. The best way to explain being attuned to is saying somebody gets me. Somebody can understand not just cognitively what I'm feeling, but really understands my experience. Say it again. Feel with me. Feel with me. Helping them feel felt. Empathy, but not just, we'll talk about what it means, like how to demonstrate that attuned to, but it's more than empathy. It's the child really feeling, seen, heard, understood, and that the person can actually encapsulate what they're experiencing. Yes? Yeah.
Isn't attunement the parental mirroring of child attachment?
Okay, so we're going to go into attunement more in depth. It's one aspect of it. Did we skip a slide or are we? Nope, we're good. Keep going. Okay, so responses that aren't spoken about enough. So we mentioned withdrawal, right? That hypoarousal response. Opposition, aggression, it's on there. Rejection, sensitivity, dysphoria gets its own slide because that's a topic in and of itself. Social cognition challenges. So this is really interesting from my experience because oftentimes I will have adults come in and adults will tell me, I was diagnosed with autism spectrum disorder. I was told I have Asperger's, et cetera, et cetera. And over the course of treatment and over the course of really working through their history, all of a sudden, their radar seems to shift. Their ability to be in tune with their surroundings and to have greater what we call social cognition has really developed. And what might have looked like a neurodevelopmental disability is in fact complex trauma playing out. Because how could you be attuned to your peers? How could you know what someone else is experiencing or how to respond to somebody else when you don't even know what's happening within yourself? That, I think, is just an interesting thing in its own right. We mentioned poor executive functioning, fawning behavior. So we say fight, flight, freeze, fawn, people-pleasing, right? What can I do for you? How can I help you? I want to do right by you. Negating one's own needs for somebody else. I'm going to come back to it. Thank you. I don't know, right? I don't know. And here's the truth. In that moment, that child, that individual might not know, because the brain is so taxed by other things. Irritability and aggression. Now, somatic complaints. My head hurts. My stomach hurts. I'm not feeling well today. I can't go to school. Another day you're not feeling well, right? And yet these somatic complaints are real because we know that when we experience emotional responses, there's no way for that to not be impacted by our physiology and for our physiology to not impact how our brain works. The other thing to know about that is young children will sooner know what's happening inside their body than they will be able to use the words to describe it. So you're more likely to have a young child say, I have a tummy ache today, or I really have a headache, than they'll say, I'm nervous about the chug this afternoon. Fawning is people-pleasing behavior.
Then also like unhealthy codependency?
It can be. Yeah, it could definitely develop into an unhealthy codependency. Yeah. Okay. This is really a continuation because this really reflects a lot of the things that can present as academic difficulties and what might look, again, like a neurodevelopmental disability. But I think it is important to note higher rates of referral to special education. Okay, rejection sensitivity dysphoria. So this is an area that plays out within the context of trauma. It's also something that is not spoken about enough when we talk about ADHD because it's a pretty significant piece of what someone can experience. Obsessing about negative experiences. I can't believe this happened to me. I can't believe I did this. Misreading constructive criticism. Try giving feedback to somebody who might have experienced a traumatic situation or to a child with an executive functioning disorder. 9 times out of 10, they are going to view that in a negative light and feel that they are being attacked, whether or not you intended to say it in a way that was kind or compassionate, or it doesn't make a difference. How the body and the system is going to read it is going to be negative. Viewing minor rejections as catastrophic. Again, I might feel it as a 1, but somebody else is going to feel it as a 10. Social withdrawal, negative self-talk and emotional outbursts, people-pleasing tendencies, right? And that's the fawning behavior that we spoke about.
What about someone who rejects praise? Is that also?
Oh, I mean, yeah, so someone who rejects praise, I mean, that's a whole topic unto itself, but that's not uncommon for anybody who experienced trauma or rejection or has, again, executive functioning challenges and has not a great sense of self and doesn't really believe in their abilities because that's not what the world has shown them. So absolutely. Before jumping into the next sort of the more healing part of the presentation, any questions or comments? Yes?
I'm hearing a lot of subjective descriptions about trauma and not so much objective definitions. Something you could clarify a little bit?
So when you say objective, flesh that out a little bit more. Yeah.
Defining trauma itself, what is trauma? What is it?
Yeah.
Opposed to like everything else about it.
Yeah. So when we're going to talk about it on a clinical level, right? Again, I'm going to differentiate between shock trauma, which is a one-time acute incident that impacts our sense of safety, that impacts our life, makes us feel in danger. And typically when we talk about PTSD as a diagnosis, we're talking about avoidance of that threat, right? There is a threat, we try to avoid it, but our system nonetheless holds onto it and we're finding ourselves thinking about it, re-experiencing it, being triggered by things that remind us of it. Okay, so that's sort of shock trauma or PTSD as we'll call it. The beautiful thing about complex trauma, there actually is no clinical definition for it. It's not in the DSM. It's not in the ICD. It's, no, it's not in it. Complex trauma is not in it. But how we define complex trauma, right, is when somebody experiences something and their body keeps score, holds on to it, and it doesn't make a difference. There is no objective thing that can happen. It's anything that I hold on to, me as an individual, that I experience in the absence, we'll talk about this in a minute, of an empathic witness. That's one way to define trauma. I experience something and there's nobody there to anchor me or support me or soothe me. And then I go on. As a result of these experiences, my brain begins to shift. I have what's called that sensitized stress response that then impacts how I relate to people, how I feel about myself, and mood, and my interpersonal relationships. Okay? There's one more thing that I wanted to say in response to your question about complex trauma, It's complex to heal. I know I'm going to come back to it, but there is something else that I wanted to say about it that is slipping my mind right now. But it's not what happened to you, it's how your body holds on to what happened to you, regardless of what that is.
More like death by 1,000 cuts?
Well, in what respect?
Meaning it's a lot of little things. It's not one big.
Correct. That's how it's chronic. It's right. It's typically ongoing. It's not, that's what differentiates shock, like an acute trauma, from complex developmental trauma. It's chronic. It's ongoing for a period of time. Yes. And it typically happens earlier in life. Yes.
So before you go into how to cure someone who has trauma or complex trauma, how do we see it before it happens? Like if you got a kid who says, I don't want to go to school,
Yeah.
right? So that just could be because they're having a hard time at school, or it could just be they're on the move.
Absolutely.
How do you know if it's because of trauma or it's just because the kid doesn't want to go to school?
Right. So that's an excellent question. And here's what I'm going to tell you. Oftentimes we don't. But the make it or break it is whether or not a parent is attuned to that and is attuned to their child. And we're going to talk about what that means. Meaning, I don't want you to walk out of here today being able to say, I mean, I said ideally we can all do that, right? This is complex trauma, or this is ADHD, or that's not what I want you to walk out today. What I want you to walk out is with this question, right? I'm seeing something and my child is withdrawn and they don't want to go to school. I remember I went to that presentation and Chava spoke about these different areas. And so now I need to be attuned to my child to help them feel seen. So for the purpose of me being there so that I can help them develop, whether it's trauma or whether it's them just having a difficult time at school. Okay? So the idea is you're not going to necessarily always get to the root of the issue. The question is, are you going to be there present for your child so whatever they're going through, they feel that sense of anchoring and support?
Well, you would force them to go to school, so they're not going to feel
It's not about forcing them to go to school. Let's get into it. We'll talk about what it is because it's a really good point, right? Those limits need to be there, but what does it mean to be there for your child? What does it mean to be attuned to? Okay, so I'm going to talk about this, yes?
You said how your body responds. Is it more the body than the body leads to the mind? Or like can the mind respond and not the body? Does it matter?
Yeah, okay, so it's a...
How common is this kind of trauma that's like...
Yeah, it's a phenomenal question. There's two things. We don't believe across the board that trauma can happen in the absence of the body being impacted, right? That's actually how we look at trauma, that the body keeps score, that the body is impacted in some way. Typically, brain and body, right, when they're integrated, when they're connected, what my mind thinks or how my body responds works in tandem in a way that's healthy and that enables us to develop and thrive. If we are stuck in some way, that's typically an indication that we might be going through something, right? Or we have gone through something that has created a situation where we can't move forward. It's literally like something's happening within our body or something has happened within our body and we can't move forward until it's addressed. Trauma cannot happen in the absence of impacting the body. It's difficult to recognize. Say it again?
It can't be healed through the body directly.
That's a fantastic question. Beyond the scope of this presentation, there are those who say absolutely it can.
And how common is this kind of trauma? It seems like
Very common, very common. I mean, there are studies that suggest that this is a precursor to most mental health conditions. Yes?
You were saying that often the various disorders are really sort of a misdiagnosis of what's really going on is complex trauma. But wouldn't someone who has pretty much any of these disorders really be experiencing both? Meaning, generally speaking, let's say you have ADHD. Generally speaking, you are going to be failing academically, or at least someone will say to you, someone
Yeah.
isn't trying hard enough. So a lot of these things are not being seen.
Absolutely.
Like they're kind of coexisting, and it's not really one or the other, but you kind of.
Correct. So the comorbidity is incredibly high. It's hard to know. I actually tried to bring the research behind that to the presentation, but there is no concrete data. What we do know is that an empathic witness, specifically a caretaker, right, could be the make it or break it. Because and this will lead into the next segment, I have basic needs as a child. Every individual has basic needs. We need to feel connected. We need to feel attuned to. We need to feel that somebody gets us. We need to feel that we can trust our parents, our environment, the people who are the authority figures in our life. We need to feel autonomy, a sense of I can set limits and I can say no when I need to. And we need to be able to be open to love. And what can be the make it or break it for a child with any predisposition, whether it's neurobiological or whether it's a mental health condition or is experiencing tremendous adversity, right? Because that's life. Life is adversity. Is the parent, right? Is that connection that they have. And again, that's why we also define trauma as something that happens in the absence of an empathic witness. I think that's Peter Levine, who is one of the pioneers in the field. Yes?
So to that point, what if the parents are also traumatized?
Oh, okay, great. We're going to get there. We're going to get there. Multi-generational trauma, which is why I feel like it's so important to talk about the Holocaust and to bring that into the picture as well. We're going to talk about that in 2 minutes as an intervention. Yes?
Just wanted to ask things like some things to the question that the gentleman here asked before, like I don't know if it's just a one time. Well, obviously if it's not a one-time thing, if it's a chronic thing, but I would I'm talking from my experience with my kids and myself, things like, what if the kid has things like unexplained physical, like irritable bowel syndrome,
absolutely,
or bruxism, where they're constantly grading their teeth, or so if kids have an outbreak of psoriasis, all these things are responses to stress. If you see those things together, that tells you that there's maybe the things are connected and not.
Correct. What I will also say is, and I probably should have said this earlier, the goal is not to create perfection, right? The goal is not to be the perfect parent. As a matter of fact, the data shows that the good enough parent is attuned to their child 30% of the time. I found that to be a really compelling statistic because it motivates me when I feel like, do as I say, not as I, do. But the idea is that regardless of what someone's experiencing, because again, we're all going to go through life experiencing tremendous adversity and complications and things that there's no way to make better. You cannot take, for example, a chronically ill child and say, I'm here for you, it's gone, right? But what we can do is we can be that empathic witness. So regardless of what a person might be experiencing, there's somebody there who's able to mitigate the negative outcomes and to really help them feel seen and heard and soothed. Okay, so we ask, are these biological needs met? I think I mentioned this is based on the neuroaffective relational model, Dr. Lawrence Heller, also a pioneer in the field of trauma. I really love this approach. It's top down, bottom up. Won't get too much into it, but what I think is tremendously impactful about this approach is that it's not just reactive. It's not just like, okay, we're stuck, so what do we do now? It's proactive. What can we put into the home so that we could bring these necessary key ingredients to helping our children thrive? So I think I mentioned when these developmental themes are met, when children experience this in childhood, regulation and connection are experienced, we feel safe and trusting in our environment, fluid and connected to ourselves and in others. So when we have these developmental themes and our basic needs are being met, when I feel that somebody is connected to me and sees me for who I am, I can in turn connect to the world. I can be in touch with my body. I am less likely to look for ways to escape or to disassociate. I'm less likely to engage in addiction if I feel connected to my body. Attunement, our ability to know what we need and recognize and reach out for and take in what life has to offer. If I feel that somebody gets me, I'm going to get myself. I'm going to know what I need. When I have feelings, I'm going to be able to hold them and honor them and validate them. Trust, when someone trusts me, or when I can trust somebody else when they are predictable, when I know that they will set a limit as is needed, when I know that they are setting appropriate limits, when I know that I can trust their responses, I am going to be able to trust myself and have healthy interdependence. Autonomy. Everybody wants their kids to be able to set limits with others and to be able to respect themselves. When I respect my child, when I am able to recognize as a person who has choices and who has the ability to heal and to grow, a child will feel that for themselves. And lastly, love. If our hearts are open and compassionate And again, I go back to that idea of being a compassionate explorer. If I'm not looking to problem solve or to manage the moment, and I also have to say, we are a community. The Frum community oftentimes has to be very problem solving oriented because there's so much to balance, right? Day in and day out. We have yontif, we have multiple children. There are always things going on. So I can speak for myself. My brain always goes to that place of tachlis, what do I need to do? And sometimes it's not what do we need to do, but what does my child need in this very moment? What do they need from me? How do I connect with them? So rather than knowing the answer, I can just sit with them and let them know that there's somebody there who wants to see them and wants to understand them. Parental attunement. Parental attunement is the art of tuning into your child's unique frequency. Every child is going to have their own values, their own direction, their own complexity. But we're tuning in because we want them to feel seen and heard and understood. We don't want them to feel like they're a problem-solving challenge. We want them to be seen as the love of our life who is there to be honored and valued. Okay, so I want to talk about parental attunement, some how-tos. So when you leave here today, you could say, she didn't only speak about it, but I actually can work on some of these things that likely we're all working on in this room. Being present and fully engaged. So that's a difficult thing, as I mentioned, because our lives are so busy. And we're having, typically there's thing after thing, crisis after crisis. That's just the way the world works. But being able to put away distractions, being able to say, I'm setting this time for you. I'm letting you know that I want to see you, that I want to spend time with you, and that I want to know what's going on with you. Listening actively, not just listening to what they're saying, but paying attention to nonverbal cues, right? When my child rolls their eyes when I say this, what are they conveying to me? What are they trying to get me to understand? Responding with sensitivity and respect. And this is really difficult because sometimes we can't respect the behaviors they're engaging in. Or we're looking at this and we're getting so triggered because we're thinking, oh my goodness, what are you doing with your life? But the listening respectfully is about being able to put yourself in their shoes and approaching this with empathy and with a sense of what is it that you need right now from me. Be consistent, right? Because if a parent, and again, this is not to undermine efforts because this is a work in progress. But again, if we're getting triggered and there are times where we're able to be more connected, but there are times where we're going to blow up, that child is going to learn there might not be safety in having these conversations. We want a child to feel comfortable and safe being able to share with us things, even if they know we're not going to be approving of some of the behaviors. And tuning into yourself. So we were talking here about what happens when you've experienced your own trauma and you're getting triggered. And that's a really, really valuable question because I think it's very common for parents to be responding based on their life experience. That's going to lend itself to an intervention that we're going to talk about in a minute. Let me switch the slide. Okay, so as I was saying, what do we need in this moment? This is what I say when I say compassionate explorer. What does the child need in the present moment to feel connected, seen, and understood? So regardless of whether or not there's that complex trauma history, or whether or not there's school refusal because they happen not to like their math teacher, the point is you are going to be that empathic observer who the child is going to feel safety with so that it mitigates the impact of whatever it is they're going through. That's okay.
What if it's the child that's triggering and creating trauma in the parents?
Okay, so yeah. Absolutely. Yeah. And there is this idea of parents being traumatized by their children, 100%. That's very valid and it's noteworthy. And I will tell you, it is almost, I want to say it's really almost impossible to have, we all go into parenting. 100%. We all go into parenting saying, I am going to be that unique parent who's never going to get riled up and people are going to see me and here's the reality. Parents of kids with mental health challenges, with traumatic experiences, and especially with neurodevelopmental conditions do experience trauma 100% across the board. Yes. especially if you have a few of them, especially if you don't have your own empathic witness. What if you didn't have a parent or don't have a parent that's there to support you? Yes.
What about, let's say, if it's a young child who's very hypersensitive, and very often negative, like tends to see the side of negative, what's chaser for them. So how can we show them that we feel for them, yet it could come across that we're not really getting them if we try to show them the other angle?
Okay, that's a great question. So when we are trying to be attuned to the child, the first step is to just recognize and accept what they're going through, not to show them the other angle, right? If you think about this acronym, RAIN, recognize what the child is. It's not on a slide here, but this is a good answer to your question. Recognize what the child is experiencing, accept that this is what it is in the here and now, investigate. So RAI, investigate. What can I do to help this child feel seen? Do they need touch? Do they need words of, I'm here with you, I get it? Do they need a drink to let them know that you're present? You know, even children have their own love language, right? So what is it that that child needs? And then nurture, go and do it. And do this exercise repeatedly and see what it happens. R is for recognize, A is for accept. So I'm recognizing what's happening with my child, I accept, I investigate what they need, and then I go and nurture them. And by the way, when they're a little bit more regulated, remember we said that when we're feeling very intense emotions, the brain goes out of commission? Never talk to a child when their brain is out of commission because they can't internalize it. When the body is dysregulated, the brain is dysregulated. But who asked about the body-brain connection? If the body's dysregulated, the brain cannot take it in. So wait for them to be nurtured just by you being attuned and being there, and then you can try to investigate a little bit more what's going on. Yes?
Does it make it worse if like the brain is turned off and then the person is then shamed and guilted on top of it? Or like, does that even not count at that point because the brain's already turned off?
No. Especially, again, remember the sensitized stress response. If that's something that you've experienced and it's been chronic, or you happen to be, that's your trigger, oh, they're gonna soak it in like a sponge. Their antenna is gonna take everything to sort of feed that belief that they already have about themselves. It's dafka, the kids who hear it the most, we think, well, they've already experienced this, so they must have gotten used to it. No, it's every single time, it's like a hammer. Okay, intervention, yes?
What if you have a child that's totally disconnected and doesn't share anything?
Yeah.
And you can't get any information?
Yeah, and this is not only common in, like teens or neurotypical. I mean, this is also, I have parents who say to me, but my child will never communicate what's happening within. Like they can't even frame it for themselves.
Trauma within him
Yeah,
or her,
yeah.
That they feel no address
Yeah.
to share with.
Yeah.
Something could be, secretive or whatever.
Yeah.
And they just shut down.
Yeah. So, I mean, we'll talk about intervention, right? If it's really dysfunctional in their life in a way that's impacting them in the home, in their school environment, with their sense of self, we want to look outside and see what resources we could bring into the picture. We'll talk about co-regulation and how that's a part of it. But still show up and be attuned. Still show the child, regardless of what you're going to share with me, because I'm not just here to listen and problem solve. I am here for you. I recognize what you're going through. I accept it. I don't know what you need, but I'm committed to still being there for you. And this is me nurturing you. Okay, let's talk about intervention and a proper assessment. Especially, for, yes. Yeah.
You should actually say that to the child?
So every child, no, it doesn't have to be said. It's your paradigm shift, right? It's within you. As a matter of fact, I would tell you that be cautious because sometimes there's a child who you might say that to and might throw something in your face, right? Like we all know children like that who will respond to compassion and love in negative ways. They don't want to be touched. They don't want to be spoken to. You're still showing up. You're saying, I accept you for who you are in your entirety. I might not talk to you now. I might not touch you, but I'm here. Okay. Proper, yes?
They don't even acknowledge that they have a problem.
Right.
You're saying, well, I'm here for your problem, and they don't say, well, I don't have a problem, you have a problem.
Right.
So they don't even acknowledge it.
Correct.
When you talk about different personality disorders that you get to, I don't think there's been a lot of negative, antisocial, borderline, and whatnot. But what about when you're faced with a narcissistic borderline disorder, where I'm fine, the world is the problem,
Yeah.
and you know, I don't know if it's really addressed any. That might be one of the hardest because it's really it's a battle.
I mean, the research indicates it's the hardest. You're hard pressed to find clinicians who say, oh, I love to work with that population. I mean, right? There's a lot of controversy surrounding treatment and recovery, right? Cure. You're absolutely right. Beyond the scope of this presentation, but I can tell you, you know, there's likely trauma involved in many, if not, you know, we'll do that our next presentation. We'll save that for. Okay, proper assessment, clinician. Find a clinician who has an understanding of, if you have concerns related to neurodevelopment, please find a clinician who's not only equipped to work with mental health issues, who's not only equipped to work with anxiety and mood disorders, but if you believe that your child has a different way of thinking, communicating, engaging socially, find a clinician who understands the complexity of neurodevelopment, because that can be a make it or break it. Again, for this very idea that how frustrating is it if we go from person to person to try to be understood, and even the professionals aren't getting us. History.
Can I just, before you go into history,
Yes.
I've got a question regarding the proper assessment.
Yes.
Today it seems like every kid has ADHD, right? That's what they say. Every kid's got ADHD. The second the kid starts fidgeting and
Yeah.
constant, go get assessed.
Right.
And then I noticed at least that a lot of these professionals, they stick them in front of a computer and then you have to click a button every time you see something jumping, and they put all these tests. It could be, and it seems to me like a lot of times it's not ADHD, it's being misdiagnosed. How do I know which professional to go to and if the professional is doing a good job?
Yeah, Kol Neshamo, get ready for your phone calls. So it's interesting because when I wanted to show the data on ADHD, I was looking at it country by country. And I thought, Israel, you know, they're used to like kids being wild. And I think Israel has the highest rate of diagnosing kids with ADHD. I think Mexico comes in the last, and Israel's one of the top. So you're right on target. I mean, it's, you know, and we saw on that initial side, like over 20% of kids who are diagnosed with ADHD might in fact have ADHD.
But how do we know?
Right. So here's what I would say. First of all, you want a clinician that's able to differentiate. You're right. You don't want someone who's just going to check off, you know, symptoms without really looking at the child's history and the family history and how they're functioning in school and how they're functioning at home, and also has a real understanding of ADHD, because ADHD is not an attention deficit disorder. It's a modulation disorder, which means oftentimes I've heard clinicians say this to me. They will say, it can't be ADHD because the kid goes home and they brilliantly play the piano for 15 hours. How could it be that they have trouble focusing? ADHD is not a deficit disorder. It's a modulation disorder. If I am motivated, if I am interested, I could have ADHD. Oh yeah, you know, Ed Hallowell, who also one of the big people in the field, he himself has ADHD. He's in his 70s. He wrote some seminal works on ADHD. He says the ADHD brain is a Ferrari brain with bicycle brakes. Ferrari brain, right? Sky's the limit. It's the bicycle brakes that are the problem. Find a clinician who understands that. And what I would say is, speak to your cohorts, speak to organizations, do research if you can on the internet. I mean, it does take a lot of effort, but it's faulty, and it's a hit or miss, because it's not only about the proper clinician, but it's also about the shidduch. And that's the number one factor if people will succeed in treatment. It's less about what the clinician knows, and it's more about how the clinician connects to the client. Okay, so you want to come with your history. You want to come with your primary concerns. And you want to come with questions and goals. One of the questions that I encourage parents to ask, what does treatment look like? What approach do you use? What sort of efficacy or outcome rate do you have? These are valuable questions because you need to know, is my child going to be working with someone who understands this topic, who has an approach that's evidence-based? Again, go in as informed as you can, because ultimately it can be the make it or break it.
Excuse me.
Yeah.
Saying to, I can't even remember how to
That's okay.
read said, but.
Yeah.
What you meant is not to find the right professional, but to make sure that they give the right medication or the right.
Great question. So it's about finding a professional who's equipped to deal with the challenges that your child might be facing.
Not
So,
just in diagnosis.
well, I'll say it differently. It's the shidduch, right? So it's not just that they have to have the skill, but you can find a very equipped clinician who your child is absolutely not going to connect with. The therapy's not going to go. Are there, say it again? Shadchanim. Yeah. There are organizations that get feedback and they know clinician styles and personalities. Yes, follow up with me. There are organizations that do the research on clinicians and really work based off of feedback. So the answer is yes. I'm going to move forward, and then if we have time, I'll save time for questions.
So
Yeah.
again, you were not saying that a professional could necessarily make mistakes regarding the types of medications. You were not saying that. You're saying it just.
I'm not even talking about the psychiatric piece. I'm talking here specifically.
Even just for ADHD.
Yeah, I'm even here just talking about the clinician piece, that they should be somebody who really has an understanding of neurodevelopment in conjunction with larger mental health issues, because neurodevelopment is separate, right? Neurodevelopment is how our nervous system and our brain, begin to develop in conjunction, whereas mental health typically comes later, and it can be an outgrowth of a neurodevelopmental condition.
With kids, it should be connected, like, they shouldn't, no.
When you say developmental as opposed to like anxiety.
Correct.
And depression.
Correct.
And borderline personality.
Correct.
Those are not developmental.
Correct. Those are not neurodevelopmental as they're classically defined. Correct. Okay. Coherence narrative. Okay, so I love this idea of, well, what about us? We're all carrying our own set of circumstances and our own challenges. And anybody here heard of Daniel Siegel? Parenting from the Inside Out, the Whole Brain Child. So passionate about his work and what he brings to the field, and it's a great read for any parent in this room who wants to understand their child's development. He talks about the importance of a coherence narrative. The idea behind a coherence narrative is, I've taken time to invest in myself and have taken time to try to understand what my life story is. I don't just have this idea of what I've been through or what my life has been, but I have a coherent, a whole, complete, healthy, integrated narrative. I have a story that makes sense and that I can appreciate and has led to growth and development within myself. This is a really fancy way, a coherence narrative is a really fancy way of saying, yeah, build your self-awareness, develop yourselves. It doesn't have to be through therapy, right? It can be through really engaging in introspection and trying to integrate different parts of your life. Why is that so important? Because the greatest predictor and the only predictor, right, when this is the only study that they've done that could predict how children will attach to their parents. So how a child attaches to their parents is based on what's happening between the parent and child. Is it a safe relationship? Is it a trusting relationship? Is it a predictable relationship? Factors that lead to security and safety within that attachment are predicted solely based on a parent's coherence narrative. It's not based on how the parent was parented. It's not based on what classes the parent took or the trauma they experienced. It's based on how the parent has grown and understood their life experience. And this is so hopeful and so inspiring, I think, because it really enables us to think of ourselves as not only healing ourselves, but healing future generations. If I know what I've experienced and I have a sense of what happened in my own life, I can in turn attach to my child, or my child can attach to me in ways that create safety and security. Healthy understanding of self leads to attunement, plain and simple. So that's another intervention piece. It's the assessment, it's the parents working on themselves.
So you'd say someone with good midos, who worked on himself, would be someone who would be better at that.
Yeah, I think good midos is more of like sort of, I would say someone with tremendous self-awareness and someone who has grown and developed because of how they've understood their life experience. Yeah. Co-regulation. So as we're reaching our end, it's about providing warmth and responsivity within relationships, that attunement piece, helping my child feel felt. It's about me understanding my own life experience. It's about helping my child find supportive environments, whether that's going to be a therapist or whether I recognize that my child might need a group of similar-minded individuals or just one friend who's going to help them feel seen. Coaching and modeling self-regulation skills, that's very much dependent on how we've internalized our own life experiences and whether we're able to self-monitor or check in. And lastly, a reflective exercise. So I want you to take a second, and this is really an opportunity to sort of bring together everything that we spoke about this evening. I want you to think about a recent experience that you've had with your child, whether it's positive or negative, and I want you to reflect for a second. How did you respond to your child during this interaction? You consider whether you were fully present or engaged, whether you were able to listen actively and respond sensitively to their needs. Were you picking up on any nonverbal cues or what was happening within that interaction? Now, if you were successful at this, I want you to think about how you could do this more. How could you enhance that ability? Whether it's setting aside 10 minutes every single day to just say, I'm going to be there for my child with no distractions, and this is dedicated to them. If you could think about other opportunities or whether or not you can cultivate different opportunities for connection and attachment based on what speaks to them, based on what they need. And that might just be sitting at their bed at night for 5 minutes, or it might be taking them with you grocery shopping, or it might be the next time they tell you that they did something outlandish, pausing before you react. I'm not asking you, I started off this presentation saying, don't problem solve it. Don't walk out of here with a concrete plan, but rather create a paradigm shift, or if you're already doing it, enhance it. Think how you can leave here today to create a 2% difference in the way that you relate to your child or how you think about them. Come at this from a place of being a compassionate explorer, asking questions, approaching it with curiosity, looking for red flags, not because, again, you want to say it's this definitively or it's that, but because I want to be an empathic observer and because I want to be there for my child to be seen and heard. Yes?
So it's really important for a child to have friends that see them. What happens if on one hand that is beneficial for the child, on the other hand it's a really bad friend group?
Yeah. When you say...
like really bad influences, drugs.
Yeah. Okay. Fantastic question. So here's the thing about being seen and heard. When we're seeing and hearing somebody, we're really seeing their authentic self, right? We're really seeing them for who they truly are and what they're truly capable of and accepting their limitations. But being seen and heard is also not just about being compassionate in the short term, right? It's really, it's about being there for the person so that in the long term, they have this sense of safety and security. So when we talk about being a compassionate observer or being a compassionate explorer or seeing someone, really seeing someone, if we're seeing them in a way that doesn't really access their authentic self, if we're seeing them through the layers of dysfunction, that's not really seeing them, right? It might feel like that in the moment, but it's not about, it's kind of like me not wanting to fight with my child and them saying, please, and them saying, please, can I go? And I think, oh my gosh, this is incredibly detrimental for my child in the long term. So I'm seeing him and I'm saying, yes, right? But is that really seeing him? That's not really seeing him, right? Because if I'm seeing him and valuing him, I'm not going to want him to go because I'm seeing his authentic self. I have true compassion, which is, I see you. This is not good for you in the long term. So something that inherently is dysfunctional is not really seeing the other person, if it is dysfunctional.
Right, but how do you put a stop to it? I mean, telling your child, your teenager, like, you cannot hang out with these people.
Yeah. It really depends. I mean, there's so many factors that play into that and into the larger relationship and into how your child will respond. And, it's not an al regel achas answer, but it's a really good question. How do I attune to my child in a way that they start to hear what I have to say? Yeah.
So from the title of Building Resilience in Children, I didn't know what you're going to talk about, right? But I was like, okay, maybe she's going to talk about boundaries, or maybe she's going to talk about their inner strength to be able to say no to, say no to drugs or say no to whatever, right? So I'm just trying to understand after what has been said, which was very interesting.
Yeah.
I don't know, me personally, I don't know, like, so what, like, I feel like, you know, the same questions, what's the bottom line? If you are connected to them and you're there for them and you're exploring with them or next to them their traumas, basically, because maybe I can't even help them.
Right.
I can just empathetically, I don't know, watch
Yeah.
it, hold their hand through it, right?
Yeah.
So in their talk list, they have this multi-trauma, inborn, developing through life, whatever it is, then they're making the stupid decisions that they're making, right? What resilience did I build in them in just holding their hand? Like,
Yeah.
that's going to be their resilience? Just
No.
the parent,
Yeah.
you know?
Yeah.
Or the caretaker or the teacher, whoever it is.
Yeah. Yeah.
They can have friends, they can feel good about themselves, they can whatever. And if they have ADHD and they're impulsive and their brain is not, you know, or dopamine, whatever it is.
Right. So you're saying
Decision.
yeah. So first of all, it doesn't make a difference if a child is traumatized or they have ADHD or they don't. Children are going to make stupid decisions, beginning and end, right?
More so. If
Yeah,
are
but
with
and more so
all
for
the things
sure.
that you just mentioned.
100%. And so here's the thing. First of all, we don't always see the fruits of our labors in the moment. As a matter of fact, I would say child rearing is really about seeing the fruits of our labors later in life, right? We don't see attachment necessarily play out in the short term. We see it play out in the long term. And in,
With who? With a parent?
meaning a child attaching to a parent, yeah, right? We don't often see that, right? A lot of times parents come and they say, I've done everything, and look at my child. The make it or break it is not about the short term, and it's about making stupid decisions. It's about witnessing all these things, and it's about setting limits and understanding your individual child. I wish I had all the time in the world to delve into specifics, right? But when we talk about resilience, we're not talking about a momentary thing. We're talking about continuous interactions and connections and moments that lend a child to feeling secure and to feeling strong and to feeling a sense of safety and security. That is resilience.
And that is that's the max the parent can give as a gift to their child so that they will have.
Oftentimes, yes. Oftentimes, yes. I joked recently with a client. I said, I wish I could write a book that would be called like, easier, better, easy-ish, because it's not going to be easy and it's not going to seem ideal by any stretch of the imagination. The question is, and this is really what I want you to think about, without that attunement, without that connection, without that sense of being able to really see your child for who they are, what would happen?
No, I'm not negating that.
Yeah.
I'm just saying, is that enough for them to have their inner police? For them to have that inner
No.
boundary?
No.
It's like what
It's not.
Rabbi Lazar was talking about,
Yeah.
The world and all that. We
Yeah.
grew up in the 80s in America, we didn't have even
Instant gratification.
What?
It's not enough.
So what?
It's not enough. It's key ingredients, but it's not enough.
So hard.
It is so hard, right? Because there's also mazel, and there's also a biological. You can have two kids in the same family experiencing the same parenting, and how they're both going to emerge is going to be vastly different. For anybody interested in this read, there's a 500-page book called The Orchid and the Dandelion. One became a prominent physician. One committed suicide and spent their life living with bipolar. Same family, same set of parents, same genetic history. It's not. There's so much more that goes into it. But this is what you could do. This is within the domain of your control.
Isn't resilience the thing you want to build in advance, like a preventative that if and when the traumas happen, they will be able to bounce back and they'll be able to.
Anything that I'm talking about today here is both preventative and in response to. These are key ingredients if you're dealing with a struggle that's already emerged, and if you're a parent saying, well, I haven't even considered these possibilities. These are things to put in place at this very given time.
Because in engineering, you want to build a structure that will take stress that you predict over time.
Absolutely.
Whenever storms
Yeah.
and earthquakes will happen,
Yeah.
so you build a building. You don't start putting resilience in a building after there was an earthquake.
Absolutely, absolutely. Yeah, and everybody's on their own trajectory. Everybody's got their own set of circumstances. If you can put in place now, before the fire emerges, that's terrific. And if it's after the fact, it's still valuable. It could still change the brain. There's tremendous plasticity. There's tremendous healing and growth that could happen even when we don't see the impact in the short term.
There's also the other children.
And that in and of itself could be traumatic, for sure, for sure. Thank you, everybody. It's a pleasure meeting with you tonight, and I wish you lots of atzlacha on your individual journeys.